Right.
I think we should go ahead and get ready. Good
Okay.
morning, good afternoon, everyone. My name is Lee Dobson. I am with Hearts for Home Care. We're a social welfare organization working to protect access to quality care at home. And with me are some colleagues that we're partnering on protecting Medicaid here across North Carolina. I'd like to introduce Tim Rogers. He's the president and president of the Association for Home and Hospice Care for some welcoming remarks.
Yeah, thank you, Lee. Wow, what a collaborative and partnership we have with all of you. And this, we all know, has been a very trying time, a roller coaster situation. And we are pleased and proud to have at least 18 state associations and or organizations committed to trying to restore the funding that we need desperately back in Medicaid and to have this event a success. We all know that they're coming back for various reasons, and we need to take advantage of when the General Assembly comes back in order to get our points across about our Medicaid needs. I just want to say thank you to Lee and to Hearts for Home Care. I want to say thank you to all the organizations and to all the advocates on the ground who have helped to make this possible. This cannot be successful if we're not all there together, unified and asking for things that matter for our clients, our patients, our families, and to make sure that we have some success. We have got to move the needle, and that needle has got to be moved quick and fast. And I can't thank everyone enough. And I'm optimistic that we'll be able to make some headway. And I'll leave it at that. And Lee, turn it back over to the rest of the agenda. And I know that the members of the association for home and hospice care are very proud to participate in that. And I thank William for leading the fight on our side.
Remote Zoom one? Can you click on the one?
With thank you, Tim. Appreciate your welcoming remarks. I echo. There's a coalition of about 18 organizations, statewide associations representing both home and community-based organizations, mental health, developmental disabilities, substance abuse. We have advocates, we have professionals. And all looking to support seniors, children, and individuals living with both physical and intellectual and developmental disabilities. We're all united for this day of action in Raleigh. Our voices come from across the state, and we're asking for a single thing. We're asking both the General Assembly and the governor to fund the Medicaid rebase, and that will protect access to essential care across the state. Today's agenda will focus on a few things. One, the purpose of the call is really just to make sure that we're all on the same page when we are in Raleigh next week. And also when we're working on our virtual option for those who can't attend in person. So we'll talk about the state of the state. So William Glenn will provide a short update on what's happening at the General Assembly with the governor's office on this issue, so that we can use that as our grounding foundation. Then Bliss Pointer will provide some information on the logistics, where to meet, what time to meet, what to bring, that kind of information. And then my colleague Marissa Fogel will provide just a few bits of tips on how to capture a good impact story. And then we'll open it up for some questions from the group. So without any further ado, I'll turn it over to my colleague William Glenn to provide a state of the state.
Thanks,
Oh,
Lee. Yeah, William Glenn, Vice President of Government Relations and Public Policy for the Association for Home and Hospice Care of North Carolina. My goal is to kind of give you a general idea of what's happening at the General Assembly, the makeup down there, what they've been talking about, and then what we've been doing to try to address all of these Medicaid proposed cuts that have gone into effect. So we're in the first year of what they call the 2-year biennium. They have a 2-year cycle. The first year is the biggest work anybody does in the first year of the biennium is to pass a state budget. That was supposed to be done on July the 1st. That has not happened. There were some serious disagreements between the House and the Senate related to scheduled state income tax cuts, as well as state employee and teacher pay raises. At the end of the day, they couldn't come to an agreement. They packed up their bags and left Raleigh for the 4th of July, with plans to come back once a month until the end of the year. At the end of July, beginning of August, the department said that they were going to need additional funds to address the Medicaid rebase to the tune of several $100 million. This sparked a very large controversy. They've been beating their drum that they need this money or rate cuts would go into effect. All Medicaid providers across the state would see a 3% cut in Medicaid reimbursement rates, with certain services going as high as 10%. Notably for home and hospice care, that would be 8% for PCS and 8% for certain hospice services. We sprung into action immediately, pushing out calls to action. I'm sure some of you have seen my emails regarding that, meeting with key General Assembly members, getting with administration officials. I've spoken to the governor's staff about all of this. In relation to that, we knew that other healthcare providers were also doing the same. That sparked us to assemble a coalition of folks that Tim and Lee alluded to. It's quite an exhaustive list, but bear with me. It's the Association for Home and Hospice Care, the North Carolina Healthcare Association, North Carolina Academy of Family Physicians, Hearts for Home Care, obviously, the North Carolina Medical Society, North Carolina Nurses Association, SimberCare, SimberNet Nursing Pool, the North Carolina College of Emergency Physicians, the North Carolina Senior Living Association, United Home Care, MedX, Home Life Care, the North Carolina Healthcare Facilities Association, and the North Carolina Assisted Living Association. So a broad spectrum of the hospitals, home and hospice care, nursing homes, anybody that would be affected across the state, all assembled together. And we jointly put out a letter to both the General Assembly and the department urging them to immediately fund the Medicaid rebase in order to prevent these drastic healthcare cuts that we're now experiencing. That kind of brings us up to September. The General Assembly held a 3-day legislative session at the end of September. The House and the Senate introduced separate bills that would fully fund the Medicaid rebase to what they believe the level should be until the end of the year. The key difference is that the House passed a bill that would be a clean funding bill, more or less. The Senate, on the other hand, insisted that any funding for the Medicaid rebase be tied to funding for a new children's hospital, standalone children's hospital, to be located in Wake County, down in Apex. At the end of the day, they were unable to agree on a final version. Both chambers passed their respective bills and went home with at the end of September. So now we're into October. The department implemented these cuts on October the 1st. They're scheduled to come back next week, and that's why we're all here today to discuss that. I'll add that this past week, the General Assembly was here briefly, not for any floor votes, but for some Medicaid Oversight Committee meetings. They expressed their displeasure to the department on their willingness to make these cuts. It was more of an informative meeting, not so much of a we're going to fund this, but for the General Assembly to really learn why these cuts were going into effect. So we hope and everyone here can join us on Tuesday to meet with your legislators and tell them exactly why we need this money and to protect Medicaid across North Carolina. I'm happy to answer any questions at the end regarding any of that.
Thank you, William. Uh, I got so excited I missed my slide, which was, um, the reason why we're coming. And the reason why we're coming is to urge lawmakers to fund the Medicaid rebates. As William has said, both chambers have passed a bill. We also know they've each passed their own bill, and we also know that the governor's office has said funding was needed. So there is no disagreement between the House, the Senate, and the generalist and the governor's office that funding is needed. So they're all saying funding is needed. But what we just need for them to do is to work together to make sure that that funding is appropriated. And that's really what our purpose of next week is just to urge them to fund the Medicaid rebates. And your role as an advocate, someone who is in this space, either with lived experience or working in the field, is to share your story and to be the voice for those who can't be here. Um, it's important for lawmakers to understand what the implications are of these rate cuts. And the person who can share that story best is you. So just make sure that you share your story as to the impact of these rate cuts. The thing that we want to make sure is that we are respectful in our ask. We want to make sure that we're focused on solutions and not laying blame. This is a hot issue because everyone will say, well, we've done what we needed to do. And so we want to make sure that we just reiterate that we're there to ask them to work together to fund the Medicaid rebates in a way that is respectful, united, and focused on solutions. And the message is fund the Medicaid rebates. I'll turn it over to Bliss to provide some context on what to expect.
Absolutely. Thank you, Lee and William, for guiding us through what we're doing this day of action for. So now I can give you a little bit of information on how we're going to make this happen. So in the morning from 11 to 12, we are going to do our kickoff gathering. For those that have attended Advocacy Day, this is very similar to our kickoff event that we would host on our normal day in May. So you would arrive at the Natural Research Center, which is located on 121 West Jones Street. And following this slide, I will have a map that will also be shared with you all to help you understand exactly where it is, because you may have never been there, but it's on the corner of Jones and McDowell, and it's on the 4th floor. So I've been assured if you arrive at the Natural Research Center and don't know where to go, don't know how to get to the 4th floor, there are plenty of people there that are happy to help you. And if you can't find anyone, please feel free to reach out to myself, Lee, William, anybody. We can get you where you need to be. Also, during our day of action, for all those that are going to be in person, we're also going to have a virtual opportunity that you all are welcome to participate in as well, with an action alert and a phone call action. So be on the lookout for that email that will come early in the morning on the 21st, and remember to encourage others that aren't in attendance to do that as well. So after the kickoff event ends, we have guest speakers speak, we have the media present. We're going to walk over to the General Assembly where you're going to take the stories that we're going to talk about later and pass those out to your constituent legislator and any legislative office that you want to stop by. We want to hit every single legislator on this day of action, so please feel free to stop by any office. And also, we're going to have a lot of social media testimonials, videos. So if you'd like to share your story, please reach out to myself or be on the lookout for any of our team while you're there, and we can get you set up to do a video to possibly go out on the media or through social media. We can go to the next slide. And this is just a map that you all will receive a better version of later, but I just wanted to give you a visual. The star is where the Natural Research Center is located, and you can see the General Assembly is right there. I think the cafeteria is pointed out. And parking, if you've, again, attended Advocacy Day, it'd be the same parking that you would do for that day as well, but there's some right across from Halifax Mall and also right next to the History Museum. So be on the lookout for that as well. And if you have any questions, please let me know. We can go to the next slide. So, how to schedule a legislative meeting. Now, there's a lot going on, especially for the legislators. So, I want to prepare you that you may not be able to secure a meeting, but we want to give you the opportunity to get one if possible. So, when you registered for the day of action, you would have received a confirmation email that has a button, as you can see on the screen here, that says request a meeting. If you have not already hit this button prior to this call that we have today, please feel free to go back. You can request a meeting all the way up until the 21st. Now, the likelihood of getting one on the 21st is very low. But if you would like to, please feel free. And don't get discouraged if you don't get a reply. That's okay. It's still very important to go to their office. But just wanted to remind you of that opportunity. We can go to the next slide. So, how to best execute a legislative interaction. Some of you might have meetings, while some of you may only meet with their legislative assistant, and some of you may be met with a closed door. That happens all the time. So, if you do get in contact with your legislator while you're there, prepare to a 5 to 10 minute interaction. They have a lot going on. There's a lot of different bills and things like that moving through. They have a lot of caucus meetings, I'm sure. So, just be prepared that they're going to be on the run and that you can get what you need to across in 5 to 10 minutes, I promise. And we will be providing some information and talking points to you all to help kind of guide you through what to talk about in a little bit more in-depth piece of paper. And we will do that during the kickoff event as well. So you may get met with the response of, we've already done what you're asking, which is technically true. House and Senate have both passed a bill related to this issue, but the problem is they're not exactly matching up. So you can respond very graciously. Say thank you for the work that you've done. Thank you for the bills you passed. But we're here walking the halls today to try to get this over the finish line. I'm telling you, being gracious goes a long way. So we want to avoid, being frustrated. I get it's a very frustrating topic to talk about, but we want to share that we are happy that a lot of these legislators are working with us. So, if you do find their office door closed, that could mean the legislative assistant's inside and they're not accepting guests today, or they're out of office completely. Feel free to slide your story or any paper that you have to hand out under their door. There's a big gap at the bottom because a lot of people do this, and they'll just pick it up whenever they return, or if they're not accepting guests, they'll see it and place it on their desk and still receive it. So, feel free to do that. You may also share your impact story with their assistant. Meeting with their LA is just as powerful as meeting with the legislator because they're the one that's making their schedule and they're the ones sharing the issues that are most important to their constituents. So please give your story and talk to them just as you would talk to the legislator. And if you have extra stories or papers that you want to hand out and you've seen all your constituent legislators, please feel free, walk the hall, go visit anyone. Even if you see another group's already hit them, go ahead and talk to them again. Nothing hurts continuing to reach out and sharing your story. We can go to the next slide, and I believe I'm going to pass it over to my colleague, Marissa.
Thanks, Bliss. I'm just going to go through what a really good story would look like. And when we say share your story, we say that because we're here as government affairs experts, and we're great to talk about all the stats, the numbers, the budget line, the figures. But at the end of the day, it really is how your life is impacted that matters the most, your day to day, how these Medicaid services, whether they're in the home, in the community, they're affecting your loved ones, yourself personally, or even if you're just an advocate for those who, don't have the voice to speak for themselves. Those are the stories that matter the most. And so we would love for you to fill out this template that we put together, and it just kind of walks you through the best way to format these stories. And we would love for you to write it all down and then print 10 to 20 copies that then you would be passing out on the day of action. So just introduce yourself, where you're from, your name, how you're associated with the Medicaid service, whether it's home care or, the IDD population, whatever it might be. Explain that. And then explain, we like to say the negative PR, explain what would happen if these Medicaid cuts remain or if they go through? What would happen to your family? What would happen to your family member, to yourself, to your caregiver, or those that you're advocating for? Because of Medicaid cuts, it's become harder to get services, or it will become harder. And then after that, you're going to explain, why does this matter? Why do these Medicaid services matter? What does it allow you and your family, or, those who you're speaking up on behalf of, what does it allow them to do? And then this is your ask. Your ask is please fund the Medicaid rebate so that people can continue receiving the care that they need at home or in the place that they most want to be. So if you do this this is by filling out the template that you would be printing and passing out. But then if you do meet with your lawmaker, like Bliss said, you can quickly say this in a short amount of time. And I will say that once you say it once, you get down pat and you can easily say it and repeat it again. But these are the stories that lawmakers really want to hear from. And this is what really is going to make an impact on the day. I will pass it back over to Lee.
Thank you, Marissa. I don't think we can underscore the importance of having those impact stories. And this is your opportunity to put down in paper what these cuts mean to you and to your families. And what we are asking is that each individual who's registered to bring their own story, print out, as Bliss said, 10 to 15 copies, one for your constituent legislator, but then for anyone else who wants to, or any other legislator you'd like to deliver that to. The more stories of individuals with lived experience, the better. Lawmakers need to see, what or the impact these cuts are having on real people. On the 21st, so let's get back to the 21st, at the kickoff event, we will be having some guest speakers, and the guest speakers will be, of course, you've heard from Tim, you'll hear the state of the state again from William, but we're going to have 4 or 5 individuals that will be sharing their unique story with you, and it will cover all of the various auspices. We'll have folks from not only home care, but also the developmental and intellectual and developmental disabilities, from substance abuse, individuals that work in the field. So we're going to really try to be all inclusive and get different people's perspectives. And then from there, we will have identified all of the organizations that we're working with are identified individuals that are willing to speak to the media. And the media will be invited to attend, and we'll have individuals willing to speak to the media to tell their story. Throughout the day, take pictures and, post on your media. If you share it with us, we will also share it on our social media, but we just need to get a firestorm on social media. And then I think the last thing that I'd like to talk about is the rule of day. And, don't bring any signs, refrain from chanting, or, yelling out slogans. Really remember that this is a place of business, and so we need to be respectful. We will be sending out all of the slides so that you have them. But I think it's really important for us to acknowledge and recognize all of the wonderful work that the General Assembly has done to support Medicaid, not only through passing Medicaid expansion, but also any any past rate increases that have helped support the programs. It's not to say that more can't be done and more isn't needed. It's to say that, you know, these decisions are often complicated and very, very difficult, and their jobs are not easy. And so we just need to recognize and acknowledge the work that they have done, and ask them to fully fund Medicaid to support, support home and community-based services across our state. I think I'd like to turn it over for questions from the group. If you could raise your hand and we can acknowledge your question. Okay, Mel, yeah, there you go.
Hi, this is Michelle Wellborn. Thank you for this informative session. I think this is going to be a good program, but I was just notified about this in the last couple of days. Just to recap what I understand, requesting that the Medicaid rebase is passed and not cut. It's as is, and everybody working together in the whole legislator group. The net is that the proposed cuts would affect reimbursement, right? And that reimbursement would be for any provider of services that are through any Medicaid waiver or Medicaid itself, et cetera. And I guess the end result to the person, to the patient, to the Medicaid card holder would be affected. How is it a good way to put how that would be affected? Obviously, decreasing rates might drive some providers to not accept Medicaid, or also decreasing rates. How will that affect organizations like Bayada, who provide nursing?
Yeah, sorry, I didn't mean to interrupt. That's a very good question. I think your question really is, how will the lack of funding the Medicaid rebase impact Medicaid recipients?
Yes.
And it will impact them in several different ways, maybe not directly, but indirectly. Because you are correct, the cuts applied are to the providers of service and to the managed Medicaid organizations that manage the care. But that translates into less money in the provider rate, which means providers already are working on a very, very tight margin, and they will do a couple of things, right? They will, providers will try to absorb as much as they can, but at some point, when they can't, they will pass that on in wage reductions to employees. The other way is they may stop taking Medicaid altogether. And that just destabilizes the provider network. But more importantly, it limits access to care for families that really rely on this service.
Okay.
Devin, I see your hand is up.
Thank you for coordinating this massive effort. I know that we're all coordinating on the side, but you guys have really found a way to kind of bring a lot of us together. On that note, I know that some of the organizations, we sent out stuff, we've been sending out blasts all along, but with the 21st stuff, and we've kind of offered to our areas, we focused on 3 of our bigger areas, do you need transportation? Can we help with that? So in that, I saw your registration link for the 11 o'clock on Tuesday. Is it easier for me to get one of my folks on our advocacy group to work with one of your folks to say, hey, we've got about this many people coming from Abound, or do you want a bunch of individual registrations? I just wanted to kind of clarify, make sure I'm clear with my team, because they're really doing a lot of work behind the scenes as well, like you guys are. So
yeah, a lot of organizations are doing a lot of work behind the scenes to organize their constituency. So Devin, I think really the question is if the individuals want to come to the kickoff event, then we ask that they register individually.
Okay.
So that for two reasons. One, so we know they're coming because there is limited space. And number two, that registration also prompts them to send that second message to legislators that says, hey, I'm coming on this day. Can I meet with you? And then the email back will go directly to that individual, not to us. So it will create that communication with their constituent legislator.
And I think we have some overlap with that, so that's what I was trying to determine. So, and I can even have my advocacy team register. We'll figure that out. But that's why I wanted to
We
know.
can talk
kind of.
offline, Devin, on that. But
Yeah.
thank you from the Providers Council. And I'd like to turn it over to Tim Rogers, and then I'll turn it over. I see Elizabeth after Tim.
Well, the question that came before about deciding what to talk about with the cuts and everything, it just dawned on some of the staff of the association and myself that maybe that the Medicaid memo that went out that detailed the cuts and some of the Q&A
Yes.
that went with it might help. And maybe if others can't put their fingers on it, we might can send that back out and know that the hospice cut has changed within that memo, but the other parts of that memo may be reflective enough to give people a memory bank of some things to use and say, if that's helpful. So I think William and maybe Bliss and Lee can help send that out. I know the association can, if that's helpful to you.
Yeah.
Great. Thank you.
Next question from Elizabeth, please.
Yeah, hey, I've been working very diligently to get and collect client stories specific to different counties. I have also been collecting the consent forms for both Beata and Hearts for Home Care. So once I have those forms, do I just need to make sure that they're on my files, or do I need to be sending them like to Marissa? What is the process with those consent forms?
Yeah, so since this is a specific Beata client, so we'll talk offline, but you'll need to obtain the consent forms for Beata, and if you're sharing those stories with Hearts for Home Care, you'll be sharing the consent forms with us as well. But to all of the other organizations that are not part of the Beata or Hearts for Home Care network, you need to look at what your organization's requirements are on not only HIPAA compliance, but also if there's a photo with photo consent. And if as the individual sharing the story, so say I was a mom with, a child, then I could complete my story and share that all I want. But if I am giving my story to Bliss to distribute, then you've got to make sure that your HIPAA compliant forms or HIPAA authorization release forms are signed for your organization. And if you're posting a photo, the photo consent as well. And Julia, I know that you're very knowledgeable in that. Did you want to add?
Just to speak to the fact that most of the associations that are joining in this effort, the individual providers underneath, especially our nonprofit providers and our for-profit providers in the MHDD and ISUS space, all have that HIPAA compliance in place. They do it a lot when they're doing visitations to their sites, to their intermediate care facilities, to their group homes. So they already have that. And Devin, so happy to see you on this call. Always good to see you. But I do think that one of the important things is that there is going to be a very unified message. I mean, we have NCPC on this call. We have Benchmarks who's joining this effort. We have the Psychiatric and Psychological Association, the NASW folks are joining in on this. The Addiction Professionals of North Carolina, the Federation, the Autism Society, the ARC of North Carolina, and the list just keeps growing every day. And CARFMARC and CAPC. And I think, that's a much stronger message than what we have seen before, everyone really staying on this point of fund Medicaid, roll back the cuts. That's all we need you to do.
There was a question in the chat. If you're coming as an individual, where do we share the stories? If you've already sent them to the legislator. So if you're coming as an individual, you're not part of an organization, and you want to share your story, print it out. We ask you to print 10 to 15 copies of a one page and just redistribute it. Even if you've already sent it to your legislator, you're bringing it and handing it to them in person. That gives you an opportunity to expand on that story and leave it as a leave behind. We're not asking you to print 170 copies. There are 170 legislators. That's just way too much to ask. But we're asking you to print 10 to 20, two for your constituent legislator, one for the House, one for the Senate, and who represents you. And then the rest, maybe just go down the hall and hand them to the legislators in that hall. Or if you know other legislators that from other connections that you may want to share that story with. So we're asking everyone who attends to bring a unique story and to print, 10 to 15 copies. Does that make sense, what we're trying to do? Okay. We've got a few minutes left if we have additional questions or comments.
So one extra thing, you all know that if you work in the IDD space, we have an IDD caucus in North Carolina. It is bipartisan, bicameral. We are one of 3 states that have this. The IDD caucus will also have a quick meeting. And once we get that time locked down, we'll let you know, because I know a lot of you on this call not only work in the home care space, but personal care service or private duty nursing or hospice, but you also work in the IDD space. And so there will be that little section that we will have. Representative Zach Hawkins' team is trying to get us a room. Once we have that locked down, we'll share it with everyone here so that you'll have some time to maybe speak with some caucus members from both parties. And that's also another wonderful opportunity to hand out those papers.
We've got just a few minutes left. If not, I can send you on your way. I do just want to recognize all of the different organizations that are participating in this. I don't know that I've ever seen a group of like-minded individuals and organizations that have come together so quickly on an issue this important. And I think it is because it is an issue that is this important, not only just to the protecting access, for individuals across North Carolina, ensuring the stability of the provider network, and the workforce that makes this care possible. And if it wasn't for that, I think, we all know that is super important. We want to come as a group of like-minded individuals, all asking for one thing: fund Medicaid and roll back the cuts. We want to be collaborative, positive, and solution-oriented. This is about protecting families and strengthening care in every county of North Carolina. And it's not about politics, it's about people. And I think if we can just leave them with that information, we'll sure to make a difference. Tim, any closing remarks?
Lee, I think you did it very succinctly and aptly, and I agree with you. This is a massive array of people, and thank you all for helping us achieve this goal. Thank you.
Thank you.